Hi, I'm Sean Kraekel. I'm an orthopedic surgeon at OrthoVirginia, and I'm at our Springfield and Alexandria offices. I often get asked by patients, how do I know if I need a joint replacement? Whether it be a hip replacement or a knee replacement, there's often a lot of things that patients should be thinking about. And really the answer, there is no clear-cut answer. The answer that I give is if you can't do the things that you want to do, and we know that you have advanced arthritis, bone-on-bone arthritis, we've tried all the conservative options. We've tried things like anti-inflammatories, medications over the counter. We've tried walking aids like a cane, or we've tried physical therapy, and none of those things have really achieved what we're aiming for. Then maybe surgery is the right option. We often can try things like injections in the hip or knee, and we do those here in the office. But eventually, if those things aren't sufficient to allow you to do the things that you want to do, and we know that you have advanced arthritis on the x-rays, that's usually when we start weighing the options of what's the best timing to go forward with a surgery.